Hello everyone, welcome to DHN. We are here at DHN Forum Mumbai and we are joined by Mr. Neil Gomes, who is the CDO at AmeriHealth Philadelphia. Thank you so much, sir, for joining us at this forum. It was very interesting to hear you during the session. And so you come from US, you have a very different perspective of digital healthcare. US is a lot in advanced stage in terms of digitizing their healthcare. India is still just starting out. After COVID, India has picked up the momentum. What do you see? What can be translated from your learnings in US healthcare that can be applied to India?
Well, number one, and I learned a lot of this today too, because I've been connected to healthcare in India for sure for quite some time, especially through my efforts when I worked at Jefferson, being on Global Jefferson and building some alliances in India and doing some research work here in various different parts of India. I feel like, as you said, the time is ripe really for enormous digitization in India. There's the ubiquity of access, being available through Geo and other such telecom organizations in India to get digital health products out into everyone pretty much. Even in the US sometimes we have issues with that in rural areas, trying to get people smartphone access. It's not as easy as you might think. And so I think that's the first exciting thing, not different from the US, but very similar. But it's the early stages of true digital transformation, is having platforms that give access to everybody. And I think you have that here in India. The second thing I feel like, not so much that India can learn from the US. I think the learning goes both ways as we learned today. I think there are certainly some things that the US has already done and experimented with. But a big one for me is making sure that whatever you build in India also is available to everybody. Like Dr. Marshall Kerr said in the beginning in the first session, don't just think of India 75, but Bharat 75 too. The people that don't usually get access. Digital can enable that access at low cost too, right? And connect the right people together. So I think that's going to be important. That's been done, I wouldn't say perfectly in the US, definitely not perfectly, but at least we're getting there by focusing on things like social determinants of health, where we're not just looking at the health care of a person, but also all of the other socioeconomic factors that contribute to their health, and even personal factors that contribute to their health. Whether they live in a food desert, for example, where there aren't too many grocery stores or good grocery stores and a lot of fast food restaurants. You're looking at that kind of access to good food too, not just your health. So I think that's another one. And then a third, I would say, that I've seen in the US that is now starting to happen here is just the investment and partnerships. I think a lot of big tech companies, as we saw here today, are going to get interested in this digitization of health. They've done a lot of it in the US and enabled a lot of it through partnerships with healthcare organizations, with payers, with pharmaceutical companies, with medical device companies. They've really been the glue many times because, one, they're trying to sell their platforms, but usually those platforms only succeed when a problem is solved or many problems are solved on that platform. And to solve those many problems, you have to bring a lot of different people together because most of healthcare is a connected experience. It's not a discrete experience. And so I think those large platform companies, hyperscalers as we call them sometimes, coming to India and investing here, I think is a big plus. And then the venture capital atmosphere that's being created here. I'd like to see, because this has happened in the US, and I think apart from the venture capital firms, also the hospitals themselves investing. Because I think what that does is it enables anyone who's trying to build a startup to immediately get real world access, rather than just ideation in the ether and then trying to get real world access. I think that enables organizations to pivot more confidently. Like in the US, when we did that in multiple healthcare organizations that I worked in, many times the startup would come with one idea to us, And it was something that inspired them. And as they were working with us, they realized maybe that's not the thing I should be doing because the problem lies elsewhere. So I'll go solve that. And I've seen so many startups pivot, make multiple pivots as they worked with us, and then finally find the really good value prop rather than fail. I think that's something that that healthcare organizations here can incubate really well. Yeah.
Absolutely. So as I said, digital transformation in India is just starting out. A lot of healthcare organizations are now starting out implementing EMR. From your perspective, for those healthcare organizations who are starting out in their digital journeys, what would be your prescription?
So EHRs in the US really started to get traction when regulation came in and kind of forced clinics, hospital systems to start using these systems. It's not good enough to, I don't think, an incentive to implement an EHR just for transaction management, which is how initially they got started out. And some of the early adopters of EHRs in the US were primarily organizations that were large and had complex transaction systems, so they needed almost like an ERP, but for healthcare. And so, but then they evolved into, initially they were called just health records. Now they are called electronic health records. Then they were also called electronic patient records, because they wanted to center it on the patient. So all these different versions, ultimately what they need to be, and I would like to see in India, rather than take these hops into these different versions, make it human-centered right away. Make it about the person at the end of that transaction, on the patient side, I mean, not just the hospital side, that for them, things should be accessible very easily and quickly. Like you have so many of these digital innovations in India in other industries, like if it's finance, Paytm, and all of these other applications making things easy. Do that with healthcare from an access standpoint. Make it very convenient also. So anytime, anywhere, try to innovate on telehealth, especially. In the US, it doesn't happen enough, I don't think, because there are various different factors weighing against it, whether you get reimbursed enough or not. And in India, that might be different. And if it is so, then, telehealth is a great way to flatten the space a little bit, because anyone can access this from anywhere on a smartphone, right? And with the kinds of data plans that you have here, it's really, really possible. And then I think a third thing I would say, apart from the electronic health records side, getting into the patient side, not just with apps and all that, but also with bots and AI and all that, using that really well. Because as the first speaker said, Dr. Marshall Kirk, you can leapfrog, into, okay, I'll do the things that the US did and get to the point where they are at right now. Or you can just get to the point that the US and other places are. And don't just think it's the US. Europe has some great innovations too, because they have a single payer system in most countries, and they're very focused and naturally incentivized to keep people healthy. So there's great innovations there too. But you can jump to that, just like India jumped from the regular, dialing phone that you waited for 3 months, 5 months, sometimes a year, straight to cellular phones, Same
with fintech, and interestingly, a lot of people are talking about this, that health tech is soon going to have its own UPI moment in India. We started from health tech startups, especially started from some apps which were aggregating the consultants, which were aggregating the practices. Then we went into sort of like data analytics. Then we went into, now we are looking at technologies, startups developing AI, machine learning apps. AI in radiology is sort of a big thing here. What do you think are the next trends in startups that we are going to see over the next 5 years?
Well, Gen AI is a big plus, right? I mean, I think for healthcare, I've already seen it in effect, even for things that are really personal, like behavioral health, mental health. I was really surprised. When I worked for the Tata Group here in India, we had on one of our teams, in the creative team, we had a leader who, after I went to the US, she did different things, and then she created her own startup. And she did a pivot. She first started with this product called Touchkin that, was like the life alert system in the US, where if you're chronically ill or can't manage your own health, then if you fell while you were about doing your stuff in your house, you could press this button, or even if you didn't fall, even if there was some other health emergency, you could press this button and it would inform a circle of people around you, including emergency services, to come and help you. So that way it would rescue you, kind of.
Sort of like SOS.
Yes. And now that's built into your Apple Watches and all that, right? So she pivoted from that. Good that she did that, because now it's built into other consumer devices and you don't really need a service. She pivoted from that into building a mental health bot called Visa. And I thought that, who would engage with a bot knowing that it's not a human being at the other end? Because most of the times when you are having a mental health concern or crisis, or it's a chronic issue, right? You want to talk to other people, not to a machine. I thought I was completely wrong. Oh yeah, people just want something even to listen, and not judge, but give them advice, right? And so this became really popular. I've seen it with several other startups also starting to get into this space. And I think during COVID, it actually saved lives, because it was so difficult to connect at a physical level with others, even in your networks, everyone was afraid. Probably less so in India, because I know India recovered pretty quickly and, people were moving around. But in the US, for sure, I think it saved a lot of lives by enabling, some kind of connection, some kind of listening, and I think that's one big plus area in the real future. Other areas on the digital side, I would say, also with AI, is just drug discovery. I think that's going to shorten the span of time it takes to discover things, the permutations and combinations of how molecules can help with cure certain diseases or build certain drugs. I think that's going to speed up. And India being very facile in the pharmaceutical space, they're going to be able to, I think,
Forward.
to that next state with AI. Another thing I think that's going to really Paul Walters again, I think in India, is just the management of data and AI on top of that, but not just AI, but just even the management of data. Managing data at scale, like the scale in India, is tough. And nobody's really done it, right? I mean, even in the US, retail data is certainly a vast amount of data because people are doing more transactions in retail than in healthcare, but it's less complex because, it's like you purchase something, you're done, and then there's maybe CRM data around that, that kind of thing. But health data is very complex. People have comorbidities, they have multiple conditions, they have interaction effects, that's very, very different. And so the compute and storage space that you use for healthcare images and all of that, right? It is voluminous. It's huge. So I don't think even the hyperscalers have really built technologies yet that can manage that kind of scale. But once India starts really getting on that, like if somebody wants to see their image on their phones, those images have to be digitized. And can you imagine how many images will be digitized for that to enable something like that? I think that's really going to test our cloud capabilities, the hyperscalers. I think they'll build solutions for that. And I think the rest of the world will benefit from that understanding of scale. And I think those are the things that I look for.
Absolutely. Thank you. Thank you so much for joining us. One last question, sir. How was your experience at DHN Forum Mumbai? How did you like the sessions?
It was great. I learned a lot, so I spent most of the morning learning, listening. Dr. Mashalkar's talk was awesome. I thought, all the other talks.
I think pole vaulting has become the keyword of the session today.
Yeah, that's for sure. And scale is a lot, you have scale health tech and DHN kind of go together, right? But I think the word scale was another thing that popped out for me, because India is, operates at scale. Typically, anything you build has to be built for scale. And I think also when you think about scale and you build things early on for scale, you get into this mindset of agile and and making sure that you can actually take something that was built for a small group into a larger population. I think those are the things that I took away, at least. And innovation, that was awesome.
Thank you so much for joining us.
Thank you.
Have a great
for having
evening.
me. Yes. Yeah.
Thank you.